Okay. I think we can slowly get started. Okay. All right, let's get started then. Again, welcome everybody to our live this evening. We will be discussing the topic schizophrenia and vigour with Dr. Antonia. And just to give you a brief introduction of Dr. Antonia. So Dr. Antonia is a clinical psychologist in private practice and at Westkoppies Hospital. At Westkoppies, she has previously worked in the complex mood and anxiety disorders unit, and in more recent years, she's been in the mature psychotic disorders unit. Dr. Antonia is also a lecturer for the Department of Psychiatry at the University of Pretoria and is a member of the university's Faculty of Health Sciences Research Ethics Committee. So a very warm welcome, and thank you for joining me on this live, Doctor.
Thank you. Thank you. Good to be here.
And then also just a bit of a background. I met Dr. Antonia while I was an intern at Westkoppies last year. So.
Yeah. And now she's passed her board exams and she's ready to fly.
Yes, yay. So I'm literally almost there now. Just got to register with the HPCSA. Okay. So just a bit of an icebreaker, and for those of you who have been following my series on schizophrenia, I have spoken a little bit about this and through my stories, but to ask this question again, and Dr. Antonia is going to give us a nice answer later, but what is vigour? That is my question then for the audience is, what is your idea, what is your understanding of vigour? For some of you, it might be a completely new word. I know that it was for me. So it's so we'll wait for a few answers to come in, and then throughout the live, this will be answered. But if anybody wants to give it a shot, or maybe a synonym, or what you think vigour is, if you can answer that. And then a second question I just have for those that are joining this live is, have you completed the VAS assessment? You don't have to share your results, but just have you completed the assessment? Okay, we've got a couple of people that have joined as well. Lauren and Varane, Grace, Salma, Mosima. Thank you everybody for joining. Okay, we've got some answers already. We've got Lauren that says motivation, and the toddler guru says get up and go.
Yeah, these are also congruent with vigour.
Yes, so we've got some good responses so far. So you can keep those answers coming in. Thank you for those that have answered so far. So we've got another one, capacity for vitality and energy.
Absolutely, yes.
Yes.
All part of the vigour bucket.
Yes. Thank you for that. So my first question for you, Doctor, and what I'm going to be doing today is asking Dr. Antonia a lot of questions. And she's the expert on this topic. She has a PhD on vigour and schizophrenia. So we're going to learn about that as we go along. So Dr. Antonia, what is your definition, or what is the definition, or what is schizophrenia?
Well, just quickly, I would say it's a chronic and complex mental illness that affects roughly 1% of the population. And it affects how a person thinks, how they feel, how they behave. But the main thing with schizophrenia is psychosis, or having lost touch with reality.
Yes. Yes, thank you for that. So it's having lost touch with reality, I think, is a good, and changes in your behavior. And yes, and being in the unit that you are in, you see a lot of psychosis and a lot of schizophrenia.
Yeah.
So schizophrenia has positive and negative symptoms, and I haven't actually delved into this in my series much. So it would be great to hear, what are the positive and negative symptoms of schizophrenia?
Well, positive symptoms, the positive part refers to the presence, and that's the presence of an excess or distortion of normal behavior. And part of that includes hallucinations and delusions. So hallucinations evolve when you hear, see, smell, or feel things that are not actually there. So, for example, hearing the voice of a loved one who has deceased, or maybe seeing someone in the room and they're not actually there. And then delusions are false beliefs that the person thinks are real. So, for example, believing that you're pregnant. We had that famous case last year, that the
Yes.
aunt's actually in symptoms of pregnancy, and they can get quite bizarre, like believing that your thoughts are being broadcast on TV, things like that. And then the negative symptoms, the negative part refers to the lack or the absence of normal behavior. So that's related to motivation and interest. So that can include evolution, which I'll go into a little bit later, but also the loss of pleasure and just reduced social engagement.
Thank you. Yeah, so those are the positive and negative symptoms. I'll also make a post on that later and pinch Dr. Antonia's answer. So thank you for that. And then the next question I have for you, okay, so in your PhD, you speak about evolutional schizophrenia. So what exactly is evolutional schizophrenia?
Well, evolution refers to the lack of will or ability to engage and persist in goal-directed activity. And that's like going to work or even something basic like taking a shower. And it's also the subjective loss of goals, interests, and desires. So with schizophrenia, once the positive symptoms have been treated and have started to subside, one often sits with just the negative symptoms or with avolition. But it's very debilitating for these people because they kind of find themselves simply existing in the world. And not to mention the burden that it places on caregivers. So that's the state that one is left at.
That's very interesting. So you focused a lot on the negative symptoms of schizophrenia, specifically vigor, which comes to the next question. And some of you have already given an answer to that. But Dr. Antonia, what exactly is vigor?
Well, that's a good question because we're still in the process of establishing this. It's very new, and I looked for something that wasn't very well researched. But I would describe vigor as a positive and stimulated state, and it involves your emotions, your physical being, how you think, your behavior, the social domains as well. But it's congruent with the things that the people brought, things like motivation, engagement, vitality, curiosity. That's all part of vigor. And it's in an inverse relation with concepts like avolition, burnout, inactivity. But also you can see vigor as a virtue, and it's generally something that most people would find worthwhile pursuing, even if they can't define it. But I just want to note that, vigor it seems to be a higher order concept, like the concept of time. And even though we don't actually have a definition of time, but people make use of that concept. So I think it's going to take a while for us to really arrive at a sound definition, but that's where I'm at the moment.
I think that was a good definition. Yes, because it sounds like it's a lot deeper and almost philosophical still, and that's where I think all knowledge starts, with philosophy.
And just
So thank you.
exploration in the beginning. Yeah.
Yes, and it's exciting to study something that's still in the process of being studied, and still coming to that solid definition. So no, thank you for that.
We want to build on it, hopefully.
Yes. And then also in your study, you note that there are no published interventions on vigor in the context of evolutional schizophrenia. So what made you interested in doing a PhD related to this topic?
It kind of developed after many dialogues that I had with my research mentor, Prof. Vadi van Staden. And I mean, I work in a setting, as you know, where the focus is on psychopathology and alleviation of illness, and that's important. But sometimes after everything has been done treatment-wise for the patient and all options have been exhausted, then we need to start thinking creatively. And I mean, that has to do with digging into alternative interventions that don't necessarily target the reduction of symptoms, but rather aim to build on something that was perhaps already there or once there. So in my discussions with Prof and Stardon, I got interested in Vigour from a positive psychology perspective. So I looked at what was in the literature and I found very little. And part of that was because there was no scale to measure Vigour. I found one scale and that measures Vigour in a workplace context, but that's really quite narrow in terms of its focus. Then we chose volitional schizophrenia because it's in major deficit, it's really targeting Vigour at its worst end. So we thought it's a good place to start. And, if we could make a small difference in that population, then imagine how far we could go if we went for Vigour in a positive mental health kind of approach, or for the pursuit of health among individuals who don't have such a serious illness. So that's where it all kind of started.
I think that's quite significant. I mean, as you mentioned earlier on, when someone with schizophrenia, once they're on the psychiatric medication and the positive symptoms are reduced and the negative symptoms sort of remain, and they feel so numb and demotivated and lack energy and just kind of exist, that's not a nice feeling to have. And often they relapse or don't take their medication because of those feelings.
Yeah. So if, we're not we shouldn't always aim to delete that or to get rid of that, but rather to find something that you can kindle within that person. So that's, I thought it's at a stage that maybe it's quite naive to do that, but we did manage to find a difference with a simple task that we implemented with them. So I think there's something to it.
That's amazing. That's very interesting. So the next question I have for you, okay, so with this assessment that you developed, okay, it measures, you developed now an assessment called the Vigour Assessment Scale, and that's the one that I've been posting up in my stories, and it's also been on the Vigour Project stories, and it's also currently in my and the Vigour Project's bio. So that link, which is called the Vigour Assessment Scale, measures Vigour. And originally it was designed for individuals with avolitional schizophrenia, if I'm correct from your study. And then, so you developed this assessment. Can you tell us a little bit more about the assessment?
Sure. Well, it started out with us doing a conceptual exploration of Vigour. So we considered related concepts like work-related Vigour, personal growth and initiative, behavior activation. And then we also included things like procrastination and fatigue as inverse approximations of Vigour. So from that, we developed the scale, and then we did all kinds of validity and reliability testing, and that included, checking the extent to which the VAS measures Vigour as distinct from other concepts with which it can potentially be conflated. We checked the internal consistency of the items and also how consistent it was over time, so that test-retest. So it started with quite a large scale, about 48 items, and after all the testing, we brought it down to 27. So that's the VAS that we sit with at the moment.
Okay, and there's also a little bit of a repetition, well, it feels like a repetition when you do the assessments.
Yeah, and that's kind of part of the testing, so that we can see, is it consistent over time? So it's not a mistake if you're wondering. Some people have asked me, oh, but why is it repeating? It's kind of part of where we're at the moment.
Yes, for those of you who have done the assessment or still want to do the assessment, I think it's good to just know that it does repeat a little bit. So it's not like you're starting the assessment again. And Dr. Antonia just explained why. Thank you. And then the next question I have, so the VAS, I heard you say the VAS now, I've been saying the VAS. So the VAS has been validated for the clinical population, so that's specifically those living with the schizophrenia. However, it hasn't been validated yet for the non-clinical population, so that's the general population that don't have schizophrenia. So that's what you're currently working on at the moment, is validating it for the non-clinical population. So doing this will help anybody that does the assessment compare, it'll help you now, the general population, comparing those results with those that have schizophrenia. So yeah, I just want to check if is this correct, and is there anything you can add to what I'm saying?
Yes, yeah, we can make comparisons and do that kind of thing, and we can also go further with that. We developed it specifically for the evolutional schizophrenia population, and so we know it's valid and reliable there. But for us to use it beyond that, to use it in a non-clinical population, we need to first do validation in that setting. So that's what we want to do now. And then we can use it more broadly.
And that's quite exciting. I was also wondering, this is something I just thought of now, like in what setting would you use the assessment? Like in a normal therapy case in private practice, and how could you use it to help individuals improve their vigor?
Well, virtually anyway, if you think of any kind of assessment that you use, whether it's a depression scale, an anxiety scale, it could be used at the start of something so that you can see where you're at, and then you can use it afterwards to see where you've come. You can also use it to figure out what is a person's experience of vigor, and maybe one can do qualitative testing after that and be like, so would you feel like that captured everything? Is there something you want to add in terms of your experience? So the world's your oyster. You just need to validate it.
Oh, that's quite exciting, and I can see how it would help. I think there's a couple of people that really, that shared their results with you and with me, that are excited and want to actually understand their vigor, this whole new concept. So when I was completing the assessment, at the time I was feeling a little bit demotivated, actually. Going through a little bit of a difficult time, but my vigor wasn't too bad. There was a fair amount of vigor, but it did with very few restrictions, despite the way that I was feeling. And I was just wondering how the assessment works and how that happened, because I was expecting like this terrible vigor score at the end of the assessment, but it wasn't so bad.
Mm-hmm. Well, it is subjective. Hey, someone emailed me the other day. They said that they selected categories that they thought, let's say, they were active and on the go some of the time, but their friends would say most of the time, because they felt maybe they have high expectations of themselves. So that's kind of with any self-reported scale. I would say it can be a limitation. So that's the one thing. But also the vigor that is being assessed is over the preceding 7 days. So it's not necessarily how you feel at the moment when you are taking the assessment. And it also goes beyond the emotional aspect. So it has to do with behavior. Maybe you feel like you don't really have much going on, but you still get up and do things despite how you feel. So it also should be, distinguished from the causes of vigor and its lacking, as well as the related construct of motivation and potential opposites like laziness, which I'm sure is really not an aspect that you need to worry about. But yeah, at least now having a measure of vigor, we'll be able to do some quantitative investigation of vigor and how these things are related.
Yeah, I think it can go quite far. I mean, this is, as you said, just the start.
Yeah.
But it was quite interesting to see that, because I would say in general, subjectively, I do have a lot of vigor, but at the time of completing the assessment, I felt like I didn't.
But I think in the preceding 7 days, you had been busy studying and preparing for the board exam and doing all of those things. So you were busy enacting vigor in essence, even though you probably felt like your light was burning out.
That's probably exactly what happened straight after the board. I was just like, I'm dead now.
I'm done. I'm done. And that's very normal. It's a very normal reaction to exerting yourself. And we need to look at circumstances. Someone who just won the lottery will feel very vigorous. So there's a lot
That's
that has
true.
to do with in your context.
I like that as well, the context in your circumstances, because that does play a role. So just another question I was thinking of now in that sense. So if you do the assessments, can your results then change over time? Um,
Absolutely. That's why we have interventions with pre and post testing. So you can test your vigor today and then maybe do something differently or apply yourself in a different way. Maybe try to work on your thoughts, whichever way you want to tackle it. Go do yoga, you know, and then test it again and see if there's a shift, because it's not something static. It's very fluid, like your mood and like habits that you form.
Sure, that's actually quite cool. So yeah, you can definitely test to see if certain interventions are working on a regular basis to see if your vigor's improved or
Yeah.
not.
At the
Um,
beginning of the Netflix binge, at the end, there's many ways you can taste this.
that is, yeah, I think that's quite cool. I love this because it's really something that's, yeah, something I haven't even thought of before. So
Mm.
I'm definitely learning a lot from this. Um, The next question I have is, what are some of the factors that contribute or take away from one's vigor? Um, and then also, yeah, when you get the results, you have your vigor score and also your restrictions. So I was wondering about, yeah, let's start with what are the factors that contribute to or take away from your vigor?
Okay, well, that is a great question, but it's not one that is answered by the VAS per se, because the scale simply measures where you are at in terms of the presence of vigor as well as the restrictions. But what those are specifically for the person will depend on their situation, like we talked about. But let's consider what is being captured by the scale. So in terms of vigor, we've got three things, and the first thing is task drive. So that's got to do with the get up and go to pursue tasks. So feeling highly driven, feeling eager to do tasks, persevering even when things get tough, um, doing things that have purpose and meaning. So all of that has to do with that task drive, and it's kind of a big component of vigor. And then the second thing is active mobilization. So that's the decisions that you make and then having the follow through on those decisions. So um, taking action to reach your goals, pursuing the daily things that you want to do and going for the things that you want. So it's making that decision and then actually going for it. And then the third thing that the VAS captures is, in terms of a factor, is creative effort. So that's taking an interest in new things and pursuing new plans, trying to improve things in your life. And then there are three sort of main restrictions that the VAS looks at. And the first one is captured by indecisiveness. So, being back and forth in your mind on what to do, having difficulty coming to decisions and maybe postponing decisions. And then social disinterest, so not really wanting to spend time with others, not wanting to talk to others. You can see that's quite, similar to what we find with evolution. And then the last one, I call it torpidity. It's basically a low energy disposition. So that's feeling slow, being rather weak, delaying on things that you have to do. So I would say that when it comes to trying to make sense of your profile, look at these two categories, the extensive and the restrictions, and then do some reflection, a little bit of introspection on maybe what's going on in your life or what's happening within it, so that you can try to make sense of how these 6 things are manifesting in your results. But I'm happy to talk to anyone who wants to maybe discuss their profile and maybe any items that come to mind, be like, I really, this thing, I didn't have much decision capacity or whatever it might be that they felt had an influence, or maybe you're confused. I'm happy to listen and try to figure it out with you.
Okay, thank you, Doctor. So, Dr. Antonia, offering to anybody that has completed the assessment, if you want to do a bit of reflection or understand your results or understand why you had high restrictions or low vigor or the other way around, whatever your results may be, to understand it a little bit better. But those 6 things that you mentioned now are very interesting, and I will make a summary of it after this live and post it. We can both post it on our pages so that everybody can just use those 6 points that you just mentioned to reflect on themselves and the results. So I think that was very helpful in understanding the results. You can go as deep as you want, and that's with any psychiatric measure. You do just get 2 graphs over here, I don't know, needle, what you would call them, scores. And how deep you go into that, you can do that with Dr. Antonia or on your own.
Yeah, you're welcome to reach out. It's really about it being a starting point of discussion so that you can think about it and take it from there.
No, thank you so much. Does anybody else have any questions with regards to the assessments or with regards to Dr. Antonia's study, anything related to, schizophrenia and Vigour? Before we close off today, if there's any questions, we'll wait a couple of minutes to see, if anybody's typing anything. But if you have any questions along the way, you're always welcome to drop any of us a DM, and then we will try and answer the questions for you so that you can understand it. And also thank you to everyone that has completed the assessments. I think there was a question I left out as well, was asking how does it help Dr. Antonia by completing this assessment? How does it help you?
If you're watching, you can join by completing it, because we want to go big. We've got already over 400 responses, which is amazing, but we want to really go big and establish the scale and also put Vigour on the map. So we're aiming for 1,000, and that would be amazing. But eventually we aim to use the vascular interventions to increase Vigour, and this will also help other studies that maybe want to help refine our understanding of Vigour. So every single response contributes towards this and is very, very appreciated. So thank you for all those who have already completed it. It's making a difference.
Yes, thank you so much. Not only are you learning something about yourself, but you're also contributing to research in psychology. So we really appreciate it. So far, there isn't any questions. I don't know if somebody's still typing one, but maybe there is no questions for this evening. I don't know if everything was answered. So I think then we can close off for now. For those of you who would still like to do the assessments, it is both in the Vigour project and my bio. So you could just click on the link there to do the assessment. I see there's another one now. There's a question that came in from Tess. Could you share a way in which the VAS scale can be used in an intervention of schizophrenic patient in South Africa? That's a good question.
Sure. I've already done this with some of my patients, because part of the project that I did was the scale. The other part was an intervention. It was a task that we did. So you can simply take the scale, and then let's say you want to do a specific intervention. Let's say it's mindfulness based. Then you can, a random example, then you can administer the VAS at the beginning of the intervention, then maybe give the person a task or something to do therapeutically, and then measure it again in a month's time or so, just to give it a little bit of time. And then you can see pre-post if there's been any shift, and you can use that as guidance. If there hasn't been a shift, maybe you need to change course in therapy, which is often what's needed, with people who get stuck. If it has shifted, then you keep going along in that direction.
Sure. That's where it's quite significant. It's a nice measuring tool. There's another one from Graced One. Can you still have Vigour in a state of psychosis such as schizophrenia aligned with your state of mind?
You can. The thing, though, that we find with schizophrenia is that they often do sit in their heads. So you can have that sort of cognitive vigor, but the behavioral aspect is often lacking. And I did indeed find a lot of people who participated in my study would say, yeah, I'm getting up and I'm doing things, but they aren't actually doing things. They just have these plans in their minds that they want to do things. So you can have a kind of vigor, but maybe not the the full thing or the following through and actually doing things that would be invigorating. And
That's
part of that
interesting.
psychology. Yeah.
Is that part of the restrictions, the back and forth in your own head, or?
Yeah, but they're not often aware of that, so they'll have these big plans, and I'm sure you've seen patients that have, they're sitting with, they can barely get a disability grant, but they have these big ambitions. You could say that they have to a certain sense of vigor, but it's not vigor in the sense of pursuing something and being driven. So it's more sitting in your head, which is really something that people with schizophrenia battle with, is they make big plans and they sit in their heads, but they're at home not doing much actually. And that's where we want to target it. We want to get them going and doing things.
Sure, that's very interesting. And Tess also says it's very interesting. She said she loved that, and she said thank you very much for answering. And thank you so much for your questions. I don't know if there's any others. Yeah, thank you so much, Grace, and Tess.
I just want to mention, so when you see your profile at the end, some people miss this. For you to see your restrictions, you need to scroll down on your phone if you're on your phone. So just make sure that you do that so that you can see both of the profiles.
Okay, thank you for that. So yeah, don't forget to scroll down. Lawrence also sent a question over here. It sounds like this measure can be used with other disorders too, pre and post-test testing of Vigour with MDD. Good question.
I haven't seen it in MDD per se, but I would say that since it's been done in a clinical setting, you probably can make use of it. And whether it's with, if you look at where there is the volition, it's not just in schizophrenia, it's also in other disorders, like a bipolar and a depressive state. So wherever there is that sort of thing, you can go for it. And the scale is available. It's published, so you guys can just download it and make use of it if you are in clinical practice.
Oh, I didn't know that. That's good to know.
Yeah.
Well, thank you for those who don't know or who are not in the clinical space. MDD is major depressive disorder. So when you have depression, you often lose your vigor as well. Yeah. So that was an interesting question. Any more questions before we close off? I think that might be the last one. But we're still open for more questions even after this live. We really appreciate all of you that joined the live, participated, asked questions. And once again, thank you to everybody that completed the assessment. Thank you, Dr. Antonia, for joining me on this live. And yeah, if you still want to do the assessment. And there's still another question that's come in here. Okay, if you feel good and very positive when doing questions, so you get a high score, but back at the ranch you think you do a little, but you actually don't. So if you're feeling good and positive when you're doing the questions, then you get a high score, but back at the ranch you think oh, you do a lot, okay, but you actually don't. That's a question as well.
Well, it should capture realistically what you do, because it doesn't only measure one aspect. It measures the thoughts, it measures your feelings, it measures what you actually have done. And it's also, like I said before, it doesn't measure how you are doing at this very moment only, but over the preceding 7 days. So that gives quite a bit of a window, at least, where you can do a test. So I don't think that should be a big concern.
It is a big concern. So I think, from what I'm understanding as well, is that you've got good vigor, good high school, and feeling motivated, feeling like you've got vigor, but you don't get anything done, actually.
Yeah.
Similar to what we were speaking about earlier on.
Yeah. So that's where you need to reflect on. Maybe you are, in your mind, you feel like you're doing a lot, but so that's the one factor of vigor that is being captured. But the other factors, like the decisions that you've made and the follow through, is lacking. The creative engagement of finding ways to improve your life, maybe that's lacking. and pushing through with that. So maybe some aspects of Vigour is there, but the rest needs some work.
Yes, and that's that Dr. Antonia says you can do some reflection on. And then also, I thought I would do worse, but I did well.
I think
So
we have some people with high standards among us. But maybe do a little bit better. Yes. Or maybe the scale needs some more validation. We don't know. We need your help by completing the assessment.
Yes. A couple of people said to me that they did better than they thought, but I think people also underestimate themselves. I mean, when you also see somebody with schizophrenia that really doesn't have vigor, they really, really can't do anything. Like, it's really difficult for them. So, you know, most of us that are not in the clinical setting with schizophrenia, we might not want to be doing as much as we would like to do, but we do have some vigor.
But maybe we don't appreciate our capacity actually for what I mean, being able to keep yourself clean and to go to work, that is something that is a massive challenge to some people. And maybe we forget that.
Yes, exactly. I do have high standards for myself. That's good. Yes, yeah. So you do high expectations of yourself.
Yeah.
But thank you so much, everybody. I think we are going to close off now, but just a reminder that we are open for more questions. Thank you for all those who joined. It was really a lovely live. So bye, everybody.
Okay, keep warm.
Yeah, keep warm. It's actually raining here in Victoria.
Oh no.
Yeah. Bye, everybody.
Bye.